All good to go. Good morning, everybody.
Good morning.
It's so wonderful to be here, despite the fact that I have no slides. Right? I'm just not that organized. That's just not my style. So I'm going to pitch to you, no slides, slide-free zone. I'm kicking it old school. I'm going to come up and move around here. But I'm also going to borrow a page from Lorna with freedom of speech. I'm hoping to not need a freedom to go beyond the 8 minutes. But I will start off with a little something. I'm going to take a page from your book, Lorna, in that, you know, as a physician, right? I'm the physician for Toronto, as you can see. My name is Dr. Eileen. I'm the medical officer of health for the city of Toronto. So in that capacity, I lead Toronto Public Health, Canada's largest local public health agency. We provide public health programs and services to 3 million people who call Toronto home. And I run a staff of about 3,000 people in my organization. So looking around this room, I see beautiful faces and really remarkable individuals. And while I am the physician for Toronto, right now I'm going to adopt you as my residents. And I'm telling you, you are sitting too long. Right? This is not good for you. Right? So, yes, right? This is not good for you. So, see, Lorna does, I know, but I think there's clapping and there's some shh. But for me, I'm going to do just, if I can, I'm going to take a few of my moments. I want each of you to stand up, because we're going to strengthen your core here, right? And every now and again, every time you clap, from here on in, I want us all to stand, because that way you're getting, because you know what? Sitting is the new smoking. I hate to break it to you, but sitting is definitely the new smoking, so I need you to keep standing. So, if you're in heels, I apologize in advance, but if you can, what I need each of you to do, and this is very important as women, we need to strengthen our core. And I mean that both literally and figuratively. So if we can talk about it from the physical core, what I need you to do is to be able to, it's a really good test. Can you stand on one foot for 10 seconds? 10 seconds. 10 seconds. Right? 1 foot. Right? And yes, you can, no, that's okay. It's okay to do this as long as you can. Right? Every day I want you to work on this. When you brush your teeth, stand on 1 foot. Try to do it that way. And over time, I promise you, it will get better and better, and you will feel the difference. It's actually really good for you. Circulation. Yeah. Circulation, strengthening your core. This is where your strength comes from, right? And on top of it, you're standing. So see, I have just done you. I will not even charge you for that medical advice. That's free medical advice right there. No OHIP card required, no nothing. Okay, so no shh. You can do that too if you want. Yeah. So that's a little bit, you can now sit down, I'll let you sit down. And I will tell you about the pitch. My pitch is actually a very, very simple one. So you've heard, Joycelyn, credit to you. You told us that there are about 1 million Filipinos in Canada, right? Yeah, exactly. 1 million Filipinos in Canada. We're actually one of the largest groups in the Philippines and growing. And interestingly, Richie, I think your government just announced 2 days ago that the plan is to increase the number of immigrants to Canada by 2025 to 500,000 every single year. So the interesting thing is that when you look at immigration statistics in Canada, the majority, the top 3 countries, the top 3 source countries of immigration to Canada, I can do this in 4 minutes. The top 3 sources of immigration for Canada are, and it rotates, China, India, Philippines. Okay? And I graduated from medical school a little bit over 20 years ago now. And you know, one of the things that struck me when I was in medical school was that I was probably one, and I went to University of Toronto, the largest medical school in the country. I was maybe one of 2 Filipinos in the entire class. There were tons of there were Chinese students, there were Korean students, there were Vietnamese students, everywhere. And we talked a lot about vulnerability and feeling vulnerable and afraid, right? So many of you have shared your stories. and talked about coming through periods of time that were filled with fear and vulnerability. And I cannot think of a time, having actually had my own medical scare just a year ago, I know for a fact, both as a professional, as a physician, and as a patient, that perhaps one of the scariest times in your life is when you're sick. Right? You are incredibly vulnerable. They're telling you this information, you know, you're hearing about this diagnosis, this treatment, this option, and it is incredibly scary. And if the person you're talking to, providing your care, doesn't really know who you are, where you come from, and what matters to you, it's actually really difficult to deliver good care. But my frustration has been that I look all over the place. The healthcare system in Canada, and like all over the world, is actually struggling right now. It really is struggling, thanks to COVID and all the challenges in the backlog. And I know for a fact that if every Filipino in the healthcare system, in Canada for sure, were to decide one day, I'm not going to work, the entire operation would absolutely collapse. I assume it's the same in the US, and I assume it's the same in many, many other countries all around the world. But the interesting thing to me is that it won't collapse for lack of doctors. It will collapse for lack of all the other very important healthcare professionals, but it's not people who are practicing medicine who are often making the decisions. So my simple pitch is to actually increase the number of Filipino Canadians who are participating and pursuing a career in medicine. Right? That's all I want to see. And I don't think it's asking too much. I think it's actually very reasonable. 1 million people in Canada. How can it be that at our largest medical school, there's like 1 or 2 of us, that's it? My husband is Korean. There is this giant Korean-Canadian Medical Association. I was the president of the Filipino-Canadian Medical Association 20 years ago. Then I was worried about how are we going to continue ourselves? This association will die. We're not getting new members. We need to find a way. So my simple request to you is this. If you know of anybody, and I do mean anybody, who wants to be a physician, whether they're in Portugal, but they have to be Filipino. Whether they're here in Portugal, whether they're in the US, whether they're in the Philippines, connect them to us, right? Connect them to me, right? We need to talk about it and say, if you don't even know that there's the possibility. When I talk to young Filipinos, they're like, there's no hope. They don't see the possibility. They're not even thinking about it. So let's start the conversation and actually open the possibility. Open the possibility to medicine, open the possibility to all the doors that can open, so that as a community we can reach our true potential. So that's it, and don't forget, keep standing.